The Lessons Led podcast, sponsored by American Health Staffing Group, serves as a platform for highly successful leaders to impart their wisdom to current and emerging leaders, and in particular, healthcare leaders through stories, lived experiences, and lessons learned from a place of genuine authenticity and a desire to pay it forward. I'm your host, Keith Minnis, and I'll be leveraging my over 30 years of experience in healthcare, human resources, and operations to engage, entertain, and educate the audience alongside my dynamic guests as they discuss hyper-relevant subject matter in the world of healthcare leadership. Good afternoon, and welcome to the Lessons Led podcast, sponsored by American Health Staffing Group. This episode, we're excited to introduce our guest, Geoffrey M. Roche. Geoffrey is an accomplished leader, master's in public administration with steadfast commitment and passion for healthcare innovation, future-focused strategy, transformational, culture change, diversity, equity and inclusion, and workforce impact. Geoffrey has been asked to regularly present on healthcare workforce topics at national healthcare events, including Becker's annual meeting, Becker's HR conference, among many other national conferences. Roche was recently nominated to the Forbes Business Council for his national level work. Geoffrey currently serves as a Senior Vice President of National Healthcare Practice and Workforce Partnership for Core Education. He is an adjunct instructor of healthcare administration in the MBA MHA program at Moravian University and corporate faculty member in the Population Health program at Harrisburg University of Science and Technology. Geoffrey serves on the United Way of Lebanon County and United Way of Pennsylvania Board of Directors. Geoffrey also serves as a patient safety committee for Wellspan Good Samaritan Hospital and is an elected school director for Annville Cleona School District. Roche earned his Master of Science degree in Management and Leadership Public Administration at East Stroudsburg University and his Bachelor of Arts in Political Science at Moravian University. He holds also a mini MBA in healthcare from the University of Arizona Eller College of Management, a certificate in innovation in healthcare management from Arizona State University, Thunderberg School of Global Management, the certificate in healthcare leadership from Duke Corporate University Education, and certificate in heroic leadership from Santa Clara University. Welcome to the Lessons Led podcast, Geoffrey.
Thank you, Keith, and thank you for having me.
I am thrilled to have you on the Lessons Led podcast and have been looking forward to speaking to you again. And as I had mentioned to you, I have thoroughly enjoyed your podcast as well. And I'll want to make sure, throughout here that our listeners have an opportunity to locate you and that they're able to listen to your podcast. I just love the place that you're in and that you're the part you're playing to transform healthcare today. One of the questions that I love to ask, our guests, it's just amazing to me just to better understand. And I know as the son of a nurse, I love that my grandmother was a nurse, my aunt was a nurse. I grew up and have worked with nurses for over 3 decades, but I want to just maybe kickstart us there. Talk to us a little bit about this journey into healthcare for you.
Yeah, absolutely. And obviously, as somebody that has, nurses in your family, I never thought I would come into healthcare, to be quite honest with you. In high school, as well as even in college, I actually worked in government, worked in state government, initially as a high school student, worked for a local state senator just as a part-time staffer. And then in college, I actually worked for a local state representative. Really thought I was going to go the political direction, to be honest, obviously my undergrad being political science. But, my mom, obviously was a nurse throughout all of my life and still is. She's now retired, but I always say once a nurse, always a nurse, because you're still
That's
nursing
right.
Your family and you're still nursing and giving support to others. But what was interesting about it, Keith, was that, my mom always, would talk about the work she did as a nurse. And my academic advisor back in college said to me, you've done all this work in government, but you've never done anything in healthcare yet. Healthcare from a policy issue is one of your most important areas, one of your most interesting areas. And so, through his guidance, I, decided with his help, landed an academic field study, like an internship, for an entire semester at Lehigh Valley Health Network, and had the opportunity to spend an entire semester really shadowing and also participating in the work of what was the integrated business development strategy, government affairs, public relations, and marketing department of Lehigh Valley Health Network. And through that experience, really realized that, not only was there so much opportunity in healthcare from a leadership perspective, but that you could truly, enter in one role and grow into other roles. And I saw that, through that experience. And then when I graduated, following that experience, fortunately for me, an opportunity had opened up at Pocono Health System, which ironically was the healthcare system where I grew up. And so, for me, had the opportunity, got hired initially in a community relations role, which really fit, the person that I am, the work that I love, which is very much focused on building relationships and leveraging those relationships for impact in a very collective way. And then, obviously spent 9.5 years there, moved into leadership roles, was blessed to work with some of the best leaders of my career, most notably my nurse CEO, who reminded me every day that it wasn't easy to be a nurse CEO, as well as to be a female CEO in the world of healthcare. But she worked hard and really impacted me in a pretty profound way from a leadership perspective, and definitely grounded me in a significant manner around the leader that I've become today. And so, really that experience was second to none. Having been in a community hospital setting, you wear a lot of hats. You have the opportunity to be involved in a lot of projects. And all those projects impact lives that are your neighbors and are your community members. And so, for me, I always tell people I would never have wanted to have a different job to start my career. I look back every day at the work that I was part of at that organization. And just recently actually was up there, in the region, in the community, which is about 2 hours from where I live now. And we were just driving through, and I was telling my boys, I said, look at that project was something that Daddy was part of. And so, very, very fond memories of the work that I had the privilege to be a part of.
Well, I think that it's clear that, and to me, that your mother, and shaping your love and passion for healthcare, and certainly I'm sure on some level proximity, and because healthcare is intimidating, and I have over 3 decades of being in healthcare have still maintained it's not for the faint of heart. It is, as the nurse leader had shared with you, it's hard work. It's not easy, and it's not that it's only physically and emotionally demanding, but it's challenging work. And it seems as though once we've figured it out, that the puck moves again, right? It's that they keep moving the field goal post on us, so to speak. I'm really, fascinated, and I love the whole notion of ecosystems. And you talk a lot about, just the workforce crisis that we're in, and we know that we're, facing a shortage of over 2 million nurses, Geoffrey, and I think at times I feel like it's a daunting thought to think how in the world are we going to get ahead of this? We've seemingly, pre-pandemic, right? This didn't, I think a lot of folks were looking to the Great Resignation and the Great Reflection, but this was happening well before this, right? We saw this has been a slow train coming, right? And so I'd love to hear you opine on that, kind of how this has been, something that's been coming, but more importantly, talk to us a little bit about this ecosystem and some of the solutions that you propose that we need to be considering at this time.
Yeah. So I think, first and foremost, as it relates to the ecosystem, I mean, this is certainly work that some healthcare systems across the country have done very, very well. And but I think ultimately we haven't systematized it. when we think of the ecosystem, every community generally has a healthcare system, a higher education institution, whether it's a community college, a four-year private, a four-year public. And then every region at some level has a workforce development system as well. And, ultimately, why the ecosystem is so critical is that, for all this time, we've been talking about this issue and everyone wants to point to the pandemic. But to your point, Keith, we've been having this issue for quite a while. When I was at Pocono, one of my most proudest moments was working with our CEO and our CNO to form what was a learning collaborative with our local university, which was East Stroudsburg University. And East Stroudsburg had a nursing program, and they had athletic training, and they had exercise science, and so many other programs. And we realized that we were so dependent on them, yet we weren't working together in a collaborative fashion to look at curriculum and make sure the curriculum actually met our needs, and look at bringing our healthcare leaders into the classroom so that the students could see the opportunity they had to be that future leader. And we started to do work in the schools and the K through 12 system and that type of stuff. And so when we talk about the ecosystem, we have not done historically in healthcare a very good job of knocking down the barriers outside of our four walls of our hospitals. And so, the ecosystem, it's critical to really envision Eds and Meds really coming together in a pretty profound way. And we've seen some of this, particularly when a healthcare system owns a college. We see it with HCA, with Galen, and we see it with, Common Spirit and others that have had colleges within their framework. But even then, they haven't gone deep enough. And when I talk about deep enough, it's really this idea of reaching K through 12. We've got to think of, most people enter healthcare with a passion to serve. But when we talk about clinical or even non-clinical, what we don't talk enough about is the career mobility that you have, the pathways that exist, the opportunity that you can be a medical assistant today and be the CEO in the future. And so, we've got to be really intentional about this. And why I talk about the workforce part of it is that, there's money literally sitting on the table every year in regions, youth money around youth workforce development, money that could support equity, bringing more diversity, equity, inclusion into our healthcare systems. And I just think healthcare systems haven't necessarily tapped into that in a manner that is really thoughtful and strategic. And then particularly, they haven't thought of how do you work with the higher education institution to launch a program when you actually need the program. Don't just launch it because you think you need it. Launch it with healthcare so that the curriculum, the approach, the intent is very much aligned with the actual needs of the healthcare system. And so that's where that ecosystem comes in. And one of the things I'll tell you, we learned with the collaborative back when we started this, and this was, the 2011, 2012. And so was how powerful it became for the faculty and for the staff. They really formed a partnership. And, in our case, what was great about it was that we as the university and we as the healthcare system came together so that if there was a new employer looking to come into the region, we were talking to them about what we had together. What did that look like together? And so, I always say Eds and Meds can truly move mountains. And when they partner, we can have really profound impact on a region.
And I guess what, it's something that, I've had some experience with and working at former health system, Baylor, Scott and White, and we had a collaborative with Texas Workforce Commission and with the various universities there. And I love that triangulation there in a healthy way, right? And really, as you say, ecosystem. But it was hard to get off the ground. And I think of these, rural healthcare settings and independent, healthcare settings that may not have a university. And I think it probably, I'm surmising here, but why they haven't started, it feels so insurmountable. And where do you start? And I guess, if I were, if you were talking to a healthcare system in rural Oklahoma where I'm at, or, in one of these, and they said, Geoffrey, where do we begin? How do we even get this off the ground? What would you advise?
Yeah. Well, the first thing I would say is in circumstances where, you may not be as close to a college or university as others. There are large, organizations higher education institutions like a Western Governors that, serves everywhere practically. There are others as well, Southern New Hampshire, that, despite their name, that doesn't mean they just focus on one area. And so in circumstances like that, my recommendation would be, reach out. I think like healthcare, higher education is also at a really interesting place. It's very much about a lot of challenges with enrollment, certainly a lot of challenges with kind of the faculty load that each institution has. And so we're at this pivotal point in higher education, like healthcare, where if we don't think more about partnership and we don't think more about intentional collaboration on some of these more important things, then higher ed is going to face the same and is facing, because we see this every day, the same level of closures, the same levels of mergers and acquisitions that healthcare has. And that's only going to skyrocket in higher ed. And so the other thing, honestly, Keith, is I would tell a hospital or health system, if you've got a college or university in your market, and you really want to be serious about talent acquisition, and you really want to be serious about culture and learning and development, look at the opportunity you have to truly intentionally partner, because you've got a situation where you've got experts at that college or university who could become your extended learning and development team. And that's a very different way to think about this. But as an executive yourself, a lot of times we don't have enough resources in learning and development. We don't have enough resources when it comes to culture, but colleges and universities have some of the best psychologists and some of the best experts in some of these fields that if you truly look at a partnership, they are hungry for thinking about these types of things. And so that's where I would start.
And they really do have undergraduate students and graduate students that are looking for meaningful projects to work on. And I really I love what you've said there, because I think that it just always brings to mind that none of us is as smart as all of us, right? That it really is as simple perhaps as inviting them to the hospital and to a conference center and pulling in the workforce commission, whatever that workforce commission may look like in your respective community or state or county, and partnering with them as well as the other institutional academic partners as well, the vocational tech schools that are also, because you talk a lot about certificate and degree programs as well. And I love what you said earlier. I love the kind of the phlebotomist or the environmental services worker to phlebotomist to LPN to RN, and now you're talking about really not only changing the face of healthcare, but changing that particular individual and their family economic situation as well.
Lessons Led is brought to you by American Health Staffing Group, an industry leader in contingent workforce management solutions. Whether your healthcare facility is in need of an interim leader, staffing solution, MSP, or technology to run your processes more effectively, we're here to serve your needs. HSG is known as one of the fastest growing, most trusted healthcare staffing firms in America. Recognized by independent industry publications such as Staffing Industry Analyst, Blue Pipes, Highway Hypodermics, Clearly Rated, and more, we're known for our unparalleled service and impact made for our candidates, clients, community, and beyond. So get in touch with us today. Visit our website, www.vahsg.com. There you'll find blogs, company information, career opportunities, and much more. Again, that's www.vahsg.com. Thank you for your support of Lessons Led, brought to you by American Health Staffing Group.
One of the places I wanted to turn back to again with you, I just, was struck by a committee that you are recently on, which is on the 14 steps to consider when creating an effective staffing engagement survey. And I think about, and not to have you step through each of those steps, but more around just this notion of turnover and retention and burnout and engagement. And when I read that you were on this particular professional conference committee, that you were one of the speakers, I thought there's got to be some pearls in there of wisdom that Geoffrey can share with us as well. How do we how do we reach and engage the staff? Because we're trying to figure out, I mean, we can't just keep throwing money at it. And we've watched the travel industry just, has gone up, significantly. We've got a gig workforce, but how do we begin to address engaging the workforce and this whole issue of engagement and recruitment and retention?
Yeah. I think in many ways, one of the things that we have to be very honest about, and just yesterday, I've seen and read a really good article that was in one of the Becker's reviews, particularly around the generational elements of our workforce. And I think in many ways, at practically every healthcare system around the country, and even healthcare organization, we're still treating our workforce like it was the workforce of the past, not necessarily looking at it as the workforce of today. Much in many of our healthcare systems, a much more diverse workforce. Still a lot of work to do there. But when I talk about diversity, I'm not talking about color of one's skin, but age, and I'm talking about different ethnic backgrounds. And so there's definitely been a significant change in a lot of healthcare systems as it relates to that. And yet we haven't necessarily really been intentional around what it's like to actually create a culture of belonging. Yes, it's a job. Yes, people have to work hard, but we've also have to be really intentional around what does that workplace look like? What do we do when someone's mistreated? Too many organizations have cultures where, maybe it's a doctor, maybe it's another nurse, maybe it's a leader who's so toxic, yet nothing is done about it. And so, or the policies of the organization are like the policies of the 50s, 60s, yet we're sitting in 2022. So, or 2023 in the very near future. So, we're sitting here at a time where I just think culturally healthcare has been the type where we just haven't evolved overall to truly engage. And I think, one of the elements that's really critical to me is that, most organizations do employee engagement surveys, but they don't necessarily do employee engagement surveys in the manner that I think is truly best practice. Meaning, when you do an employee engagement survey, that is not the time where you tell everyone what you've done for them. So often that happens. Oh, we want to give them an update, a summary, and then you do the survey. No, we have to do regular engagement. And it has to be 360. I'm a big fan that leadership also has to be evaluated, which means you got to have psychological safety. But leadership has to be evaluated too, because the sheer fact is we have more leaders who probably shouldn't be in organizations than still are. And yet nothing is done about that generally. And so, we have a lot of work to do in this space. And I will tell people all the time, I'm a firm believer that when we talk about, to your earlier point, great resignation, great reflection, whatever you want to call it, great reckoning, whatever you want to call it, we have not invested enough in culture. We just have not been accountable enough to really create the culture. And this is also where I actually oftentimes will say a board of directors and the trustees of a healthcare system have to spend and lean in a bit more. Because if you have so much retention issues, someone's got to pose that question to the CEO, what's going on here? You've got to be intentional on these things because ultimately people are an important part of everything that we do. And I firmly just don't understand how we have so many retention issues and it just continues and we don't actually truly get to the bottom of it.
No, and I think it always makes me reflect back on some of those books that I read so early in my career, first break all the rules and good to great. And so some of those things, that, caused us to, I think, look a little deeper into, what it creates a great culture. And as you talked about this issue of toxicity and burnout and really, again, I was even concerned with the whole kind of revelation of resilience that almost started to turn into blaming the victim for you're not resilient enough that something must be wrong with you, right? And that's not it altogether. But by and large, again, culture trumps strategy and technology all day, every day. And I think one of the areas that I often see that healthcare systems miss, and I'm curious your thoughts on this, is inviting the physicians and the physician leaders into having a voice. That sometimes they sometimes seem to sit a little bit outside the circle, and we forget to really, invite them into this whole dialogue around what makes this a great place to give care and to receive care for the patients and what they're looking for. I'm interested in your thoughts on that as well.
Yeah, no, I would agree. And I would also say, you have to include all the advanced level practitioners and providers, because,
That's right.
And so often, like, even when we talk about burnout, when we talk about, mental well-being, we don't ask our nurses, we don't ask our environmental services team, we don't ask our food services team. We talk about it more at an executive level and at a leadership level, but ultimately, if we would take the extra time and we would round, regularly, consistently, we would hear of the issues. We would learn of the technological challenges. We'd learn of the different elements of the environment of care that are just not allowing our team to feel as if they're making a difference, and they're not, feeling so stressed or burnt out. Ultimately, some of this stuff can easily be fixed, if we would listen and enact. I think oftentimes what I've found in leadership in healthcare is there's a lot of really good intentioned leaders, but they think they know the problem, but instead of actually intentionally asking and then listening and then making a decision, they're just making a decision. And one of the things I learned early in my career, because I worked for phenomenal leaders, was, I had a senior vice president who made every one of his directors round. We all rounded. We didn't have a choice.
Yep.
We rounded, and we rounded inside the hospital. We rounded outside. We rounded in practices. We rounded in the cancer center. And the whole purpose of that was for us to have what he called fresh eyes and fresh perspective on anything that looked as if it could cause a patient safety issue and or an issue with staff or patient experience. And, we would report on that back right to him, and it would go right to the CEO. But it was powerful because people saw us as a leadership team being intentional for them and to them. And we did it at all hours. I had to go at times in the evening. I had to go early morning at times. And one time I went to the ED, and people, they actually thought I was the CEO because my name was Geoffrey, and our CEO at the time's name was Geoffrey. And, they had met him, which, obviously speaks to leaders also have to be there at all hours because the team needs to know who the CEO is. And they thought, oh boy, the CEO is here. And I said, I'm not the CEO. And then, I introduced myself, and, but what came out of it was that psychological safety. We built a rapport, we built trust. They became comfortable with sharing things with me. And after some of those experiences, they would email me regularly and say, I had this issue. I didn't feel comfortable going to my leader, but I wanted to share it with you. And then, you know what? I would go to their leader, and I would tell them, I'm not going to tell you who came to me because I'm not going to create that dichotomy, but I'm going to tell you this issue. And so we've got to be just very intentional about those things.
I think you're so spot on, and it certainly takes me a little bit back in the way back time machine here, but and not so much because he's still as relevant today. It's the work that Quint Studer, and I just love the work that Quint has done and continues to do. But rounding with a purpose, I just think it's a non-negotiable, to your point, and it leads into whether it's Q12, Gallup or other things, but my voice mattered, and that I was recognized within the last 7 days, and that I have a best friend at work. But those key words at key times, rounding with a purpose, going out, whether it's lean work you're doing and going to Gemba and listening and looking and getting to the lowest level, where does the work really happening, and what is the value added or non-value added work that the workers, the healthcare workers will tell you that they're closest. This, why do we do it this way? If we, and then sometimes things are as simple as, and not to oversimplify, but we have to walk all the way down there just to fill up our ice machine because our ice, machine has been broken for the last 6 months, and we've put in 15 requests to get it fixed. And so sometimes, there's such value in That one escapes me. It still is one that it seems like it's such a non-negotiable, but I think as leaders, and I'm not able to claim that I haven't fallen into that trap too. I'm too busy to round. I'm too busy to, and maybe I'm too important to get out there because people come to me. It's one that certainly does seem to consistently escape us. Well, Geoffrey, I know much like with your podcast, it's interesting how quickly the podcast starts and how quickly the time goes, and our time has moved along very quickly here. But I always love to end with just really the question of, and this podcast is by healthcare leaders and for healthcare leaders, and I have a lot of emerging healthcare leaders that are listening to the guests and listening to their advice and words of wisdom. And I just would love for you to impart to those emerging healthcare leaders, or for those out there, I believe we need them now more than ever, and we need them to stay faithful to the struggle right now. But would you just take a few minutes just to share some of your words of encouragement and words of wisdom to the listening audience?
Yeah, absolutely. I think for those who are emerging or aspiring leaders, these are those moments where I would really encourage you to think very hard about being a mission-focused leader. Somebody who understands that, we call it heroic leadership, as coined by Chris Lowney, who, obviously, as you know, Keith, is the chair of the Common Spirit Health Board of Directors. And when you read Chris's book, which I've had the privilege to do, and then obviously took Chris's program, the Certificate in Heroic Leadership at Santa Clara, one of the things that resonates so much with me throughout that program, and still to this day, is Chris talks about purpose-driven leadership and love-driven leadership. And when you think about it, a leader should love first. Everything that a leader does should be done very much focused on mission, vision, values, but should always be human-centered. And so a leader should ask themselves all the time, did I do this for my fellow staff member? Right. Did I do this to support my patients in healthcare? And so, that is really, really critical. And the other thing I would say is, now is really a time to really think about what the future of healthcare looks like. And to your point, we need everyone as part of that. We need people who are towards the end of their career to mentor those of us that are earlier in our careers. But mentorship has to go both ways, and we have to have good mentors. We can't have bad mentors. And unfortunately, in healthcare, we've had a lot of bad mentors. But we've also got to really build this community, build this network where, individuals who are aspiring or emerging know they have fellow colleagues who are going to walk alongside that journey with them. And that's where mentorship can be so important. And the final point I would make is, just continue to find ways from a leadership development end. Doesn't matter what level of a leader you are, you should always want to learn more. You should always want to be driven to be educated by everybody and anybody that's in your ecosystem. Because if we do so, we know that we can learn a lot of new things and really be in a position to give back in a more significant and meaningful way.
I love that, and I really appreciate that, and I have to believe that my producer Macy was locking into that will be part of the sound bites for our promos with you, Geoffrey, because I just again, as I've shared with you, I could talk to you for hours on end and just learn so much from you, and from your walks, from your speaking engagements, from just how intentionally you listen. And I think that I always admire those that and you don't have to be that great to do a better job of listening than I do. I don't think that I'm the best at it, but I work at it, and I think that it is something that we all need to aspire to be better at, to use the 2 ears that God gave us for sure. Well, Geoffrey, I shared with you, I love listening to your podcast. How can folks, if they want to connect with you or listen to your podcast, how would they best find you out there?
Yeah, so absolutely. People can certainly find me on LinkedIn, very active there. And obviously, if they're interested in listening to the Ed Up Health Up podcast, just type into Google Ed Up Health Up. It's part of the EdUp network, which is very focused on the higher education space. But this, as you mentioned, is really at the intersection of education and healthcare and the ecosystem of workforce development. And so that'd be the great way to connect, and happy to connect at all times with anybody that's interested in any of these topics.
Well, I know that I've been certainly enriched and blessed by not only the friendship and the partnership and the collegiality that I have now with you in this space. I can't thank you enough for what you've done, what you're doing, and what you're going to continue to do for healthcare and continuing to transform healthcare. I would encourage my listening audience to reach out to Geoffrey and certainly listen to not only his podcast, but your publications as well. Attend your conferences that you are a panel guest on so frequently, and I'm again wildly impressed by. But I want to thank you first and foremost. Thank you for what you're doing. Thank you for your commitment to healthcare. Thank you to your mom for being a nurse and raising a son that went into this field, thankfully, and is raising a generation as well. And I'm not sure that your boys will follow along, but they will at least have a great mentor and a father who's shared with them some tremendous insight into the healthcare industry. Well, want to thank our listening audience for listening to the Lessons Led podcast and our guest today, Geoffrey Roche. I also want to thank our sponsors, American Health Staffing Group, for their sponsorship and allowing me to serve as the host of the Lessons Led podcast. This is Keith Minnis and signing off.